Okay, we're resuming now. Neela, you talked there as a surgeon about how certainly in Australia surgery has been seen as a toxic culture for women and for in many respects. How do you characterise it and where it sits, and whether there were big problems, there was big action taken? Are we seeing improvements?
Look, I think the culture of surgery is absolutely improving, and I think that one of the things that the Royal Australasian College of Surgeons should be commended for is taking the allegations of sexual harassment very seriously in 2015, engaging an external advisory group, genuinely investigating the problem and instituting a number of changes. And we know that cultural change takes place and surgery is by no means perfect, but a number of changes have been implemented, and that has resulted in changes on the ground from what I can see. What I think we need to talk about in medicine is not just surgeons and not just surgery. I think part of the reason why it is often in the spotlight is because surgery probably has a greater gender inequality than many other specialties, and a lot of the women in surgery do tend to be quite outspoken. And so these stories hit the media, whereas I think that a lot of our colleagues in a lot of specialties face very similar issues. It reminds me of in 2012 when I was pregnant with my second child. I didn't ask my college or training program's permission for maternity leave. I simply told them that I would be taking it, and it was granted. And this is what we would expect. But at the same time, there were some consultant physicians at the hospital that I was working at who found me and asked my advice on how they could advocate for their registrars, who were being told at the same time in 2012 that they would be dismissed from their training program because they had gotten pregnant while training. And I didn't know those registrars at the time. I know one of them quite well now, and she did actually end up leaving that specialty. So I think that at the same time where surgery has been quite maligned, I think the College of Physicians probably needs to look into their culture and their issues, as does the College of Emergency Physicians, anaesthetists, everyone. I think these are not isolated issues. I think they are systemic issues.
So a lot of things came up around the gender pay gap, about parental care, about how many heads of departments are called Peter, things like that. What's your takeaway about, really what is the most urgent, and, where do you see value in action?
So one of my colleagues, Ria Liang, published a paper in The Lancet recently looking at why women leave surgery. And a couple of the things that came up in that report was obviously about retention and how we actually stop people leaving these specialties. Some of it is giving people support, but some of it is actually about creating structures and programs that are not aimed at women. Because when you aim these interventions directly at women, it is othering. It does make out as if women are somehow different, when in fact there are greater commonalities between us. There are men who wish to take parental leave, there are men who wish to work part-time, and gender is not the only thing that makes us diverse. Women are the biggest disadvantaged group in medicine. We spend a lot of time justifying that we are doctors, but if you look at other disadvantaged groups, we have international medical graduates, we have people who are ethnically and culturally diverse, and they are being forced to justify why they're in the country at all. We have people who are, gay and lesbian, and they're being forced to justify in their workplaces whether they have a right to family and love and everything else. We have doctors who face health problems and have disabilities, and they are having to justify whether they have a right really to exist within the profession at all, and in fact whether or not they're even human. So I think that when we talk about diversity, it has to go beyond women in medicine type events. They tend to be women in medicine events because we are a big group and we can collectivise, but we have to look at this in an intersectional way, and any intervention that we institute that increases equity for people will help men as well, it will help women as well, and it will help people who face all of these intersectional disadvantages.
It's a fantastic way to go out. Thank you very much.